IGEPHA im Gespräch. Der Podcast der Austrian Self-Care Association. Greetings and a warm welcome to IGEPHA im Gespräch, the podcast brought to you by the Austrian Self-Care Association. I'm Christina Nagela. I serve as the Managing Director of IGEPHA. This autumn season, our podcast series is dedicated to a crucial topic of the future. Examine the merits of a national self-care strategy for both our healthcare systems and the well-being of our population. Through engaging discussions with representatives from self-care organizations across the globe, I aim to dive into the progress made by other healthcare systems in implementing self-care initiatives and uncover valuable insights that we can apply here in Austria. Today, we embark on an exciting journey to the continent of Australia, where Deon Schoombie oversees the management of Consumer Healthcare Products Australia, a sister organization to IGEPHA. Welcome, Deon.
Thank you very much, Christina.
Before we dive into a more in-depth exploration of self-care practices in Australia, allow me to introduce my guest for you today. Deon Schoombie, with 3 decades of experience in healthcare and the pharmaceutical industry, has served as the CEO of Consumer Healthcare Products Australia since 2010. Additionally, he holds position as a board member of the Global Self-Care Federation and advisory board member of the National Institute of Complementary Medicines and a director on the board of the Australian Self-Care Alliance. Throughout his extensive career, he's advocated for the incorporation of self-care into national health policies and the development of a national health literacy strategy as a fundamental catalyst for improved health outcomes. Deon firmly believes that responsible self-care plays a great role in enhancing individual and public health results, while also contributing to the sustainability of our healthcare system. Deon's professional journey has spanned across various roles, including clinical practice, hospital management, private business management, healthcare promotion, and the consumer healthcare product industry. I am eagerly anticipating the insights on Australia's self-care initiatives. Deon, to kick things off, could you please share your perspective on Australia's progress towards implementing a national self-care strategy? Do you have anything that's similar to that?
Yes, we do. There's actually quite a lot happening at the moment in Australia. There's sort of general agreement that the environment and the climate is right for change. And certainly the opportunities for self-care as part of health policy is actually very promising. So we've been talking about self-care for a very, very long time. As you know, WSMI, and now called Global Self-Care Federation, probably the best part of 20 or 30 years. And it's been a long journey, and the progress has been rather frustrating. Slow, I should say, but in recent times, the opportunities have definitely increased significantly, and there is an interest to look at it more carefully and actually implement it. So we are looking at significant progress in Australia. And if I can sort of look back at the journey in recent times, probably one of the highlights for us in Australia was the publication of the policy blueprint, which is called Self-Care for Health, a policy blueprint which was developed by Professor Rosemary Calder and her team at the Mitchell Institute in Victoria. So that was really the first tangible evidence of recognition of the importance of self-care. And in that document, she identified 9, I think, policy proposals to be developed, how we can advance self-care. So I think the time for self-care has come.
Sounds great. What measures have already been put into action in Australia? Have there been any changes yet?
Yes, there have.
Wow.
Back to the policy blueprint and the 9 recommendations or policy areas, 2 of them is of note at the moment. The one is health literacy, and the second one is consumer engagement in development of health policy. So what has happened, that this report was published in 2020, and in 2021, the government published or launched its National Preventative Health Strategy. And that report or strategy, which stretches over 10 years, 21 to 2030, identified several areas of key importance to advance or to expand prevention or preventative health measures. And the one, lo and behold, we were very pleased to see it, was health literacy. So what is happening at the moment, the government has commissioned the development of a national health literacy strategy. And we've had 1 round of consultation, public consultation on that. And we expect in the near future, there will be a final phase of public consultation before the strategy is published. So we're looking forward to that because we are keen as an industry to know where it is that we need to play a role. Now, we're in non-prescription medicines, self-medication, etc., management of common ailments, etc., etc. So that would be an important piece for us to take note of. The other aspect identified in the National Preventative Health Strategy is consumer engagement. I mean, we can't overemphasize the importance of putting consumers front and center. Consumers have to be part of the co-design of health policy and health services, and they need to contribute or participate in the design of a health system that will support them, that will empower them, that will give them the confidence to take a more active role in the management of their health. So those are 2 important areas. Another one, which is very exciting, and it's happened in other parts of the world, I think Germany is probably leading the way here, is social prescribing. So this is all about the non-clinical issues underpinning health. So housing, etc., etc. So that work, and also Rosemary Calder is in the process of undertaking that work. So it's embedding social prescribing in primary healthcare, where then GPs, nurses, and other allied professionals would then be able to access social services and support for consumers. So it all completes the picture of helping people to navigate the health system, to look better after their health, and to engage appropriately with their healthcare system. So very exciting work. The main focus areas for the preventative health strategy is, number 1, is reducing tobacco use. And you may know that Australia has taken a leading role in plain packaging and reducing smoking and that sort of thing. So that's continuing under the new policy and strategy. Increasing physical activity, access to healthy diets and nutrition, increased cancer screening, improving immunization coverage, reducing alcohol intake, and protecting and promoting mental health. So all of that work is currently underway.
That's a lot. What's the timeline? Do you know
Christina, the time frame for the strategy is set, as I said, 10 years, 21 to 2030. And they've started with health literacy and consumer engagement, and we anticipate that the other aspects of it will be rolled out soon. So it's very much, I think there's a sense of urgency about this, and there's bipartisan support for this from a political perspective. So it's not just the flavour of the day for the current government, and the next one would change it. So that's the good thing that we take a great deal of comfort from, is there is consensus that this is the right way to go. And critical to all of this is, of course, health literacy and how do we improve it, and particularly for vulnerable populations. Now, in Australia, we've got the Aboriginal population, the comparison to the rest of Australia, I mean, the gaps are enormous, and it would really take a concerted effort to address health issues and health literacy in particular in vulnerable populations. The temptation would be to educate and support people who already have a good background to it. So that's the challenge for us to address this.
Very, very impressive. What would you say? Did your organization, what part was your organization doing on this progress?
That's a really good question, Christina. And one of the sort of my, I suppose, frustrations over the years, I have a view that if the idea comes from industry, it's a bad one. But if the idea comes from consumers or doctors or pharmacists, it's a good idea, the very same one. So there is sort of, and I say this respectfully, a skepticism about industry putting forward that sort of thing. People sort of say, well, you're supposed to be profitable, to grow your business, that sort of thing. Why would you be interested in health policy? And my answer to that is, we want to be corporate and social citizens. We want to contribute to the health of the population. It's not just about selling product. So we had, over the years, probably the best part of 20 years, we had great discussions with many people about self-care. And people would say, yeah, it sounds like a good idea, and it makes sense, but nothing really happens. And then what we did, we established what is called now the Australian Self-Care Alliance. And it's a health promotion charity registered with the government in Canberra. And the members are multi-stakeholder, pharmacists, nurses, doctors, consumers, front and centre, industry, researchers, patient groups, etc., etc. And that, I believe, made the difference. Because, look, let's agree, self-care is beyond the scope of any single organisation. We cannot make much of a difference on our own. So we need to team up with other stakeholders in the area. And self-care cuts across everything. People who are healthy, who want to stay healthy, well-being, people who have disease, temporary or self-limiting, who participate in that, then chronic disease. All of that has got an element of self-care. And the evidence is out there. Self-care improves health outcomes. Self-care leads to more cost-effective care. So the fact that we teamed up with other stakeholders in the health space, and it wasn't coming from industry, was, I think, one of the most important lessons I've learned over my 20 years in this game. I think it's absolutely critical. If you go to government and say, well, we've got a consensus document, and that's exactly what the blueprint is. And that's why the minister, when he launched it, he picked up straight away, and the recommendations were picked up in the National Preventative Health Strategy. So, yeah, I think that's a message I would like to leave you with.
Well, that sounds great, but also a difficult task for you.
Very much so, very much so. A long journey ahead and a complex one.
Yeah. In terms of data, how would you say you could measure the effectiveness of such a self-care strategy in Australia? What should there be in 2030?
Look, the obvious ones, Christina, would be the stats that they quote every time. So hospital admissions, visits to emergency rooms, unnecessary visits to emergency rooms, unnecessary visits to general practitioners for common ailments that could be managed with the help of a pharmacist. But those are sort of very long-term things. The other one, of course, is the prevalence of non-communicable diseases or preventable diseases. But that's almost generational management measurement. What is a golden thread through all of the policy documents in Australia is monitoring and measuring and adjusting. And there is no golden rule or single rule that applies across all of it. It will all be dependent on the particular measure that's being implemented. So the recommendation through all of the policy documents are that you've got to partner with research institutions and data collecting entities, so that the design of the solution includes the measurement of it. Now, there are already a lot of measurements in relation to health literacy, the multiple ones, but it's more at the personal level and not many of them at the system level. And this is an important thing to bear in mind when we talk about health literacy. There are two components to health literacy. The one is the individual, and the other one is the system. There's no point in a consumer or a patient being health literate and the system doesn't support it. So wherever the touch points are, wherever the consumer goes, it's got to be geared towards informing, supporting, and activating and providing confidence. So I think all of it has got to be specific to the specific measure that's going to be implemented.
Well, thank you for sharing these insights into Australia's journey towards a national self-care strategy. To conclude, may I ask you for your guidance and recommendation for us here in Austria? What key considerations should we bear in mind when shaping our own national self-care strategies?
Two things. The one is partnerships, and the second one is data. Without evidence, no policy change. And in Australia, we've got some work to do. So I'm not saying here that we're good at it. Don't look at us for that. We've got to increase our input and our investment in generating data. But we've made huge progress through partnerships with other stakeholders in the health space.
Many thanks, Deon, for the engaging interview and your valuable insights into crafting a self-care strategy.
Absolutely delighted. Thank you for having me, Christina. All the best to you.
Thank you. IGEPHA is a dedicated advocate for Austria's self-care sectors. We are ready to assist stakeholders and policymakers with our expertise in advancing self-care as a fundamental pillar of our healthcare system. If you share our enthusiasm for the subject, we eagerly await your input. Further information about IGEPHA can be found online at igepha.at. I extend my gratitude to our podcast audience for tuning in, and I eagerly anticipate reconnecting with you in our next episode of IGEPHA im Gespräch. Thanks for listening.